The schedule checklist, how to greet patients like a professional. Ensure your patients all get a warm welcome by using a checklist. In this seminar, we'll learn how professionals greet a patient when they come into the office. We'll demonstrate how to use a checklist to ensure you're certain the patient will experience a warm welcome. Professionals rely on checklists to get consistent, high-quality results. The schedule checklist. S is for smile. How can I help? C is for confirm name, all the other data. H is for healthcare. E is for eye exam, check if full or not. D is to do the intake form. U is to update the exam for pretest. L is to look, check all the information is correct. E is to enter it and notify the pretester that things are ready. It is absolutely essential that we get accurate information to be able to help the patient as they process through the office. S is for smile. It is imperative you smile to put the patient at ease. You can then ask them, how can I help you? It's vital to get the visit off with a warm welcome. Smiling is definitely the most important body language we can do when we greet someone. It tells them they're welcome. C is for confirming the data. Patient's name, address, date of birth, and phone number, including the cell number to text and email to send digital information. Again, it is absolutely important that we get the information down about the patient so they can make sure we can get any information to them that we need. H is for healthcare number. Ensure you have it entered correctly and the remaining data in the front desk screen. Data is only as good as we have it accurate. E is for eye exam. Check if it's a full exam or a follow-up or a recheck or a single procedure. The schedule is your workbook to keep the office busy. D is for doing the intake form. Obtaining the background information about each patient is essential to high-quality eye care. It's important, if we're going to have someone see clear, that we know all about their health, not just their eye health, but their general health. U is to update the exam information on the computer, whatever system you're using, so it's ready for the rapid pretest. Once they're ready, put them in for pretest. L is to look over all the data and make sure your information is correct before you pass it on to the next person in your office. It's absolutely important to have two sets of eyes and recheck what we do. E is then finally to enter all the data and inform the pretester that the patient is ready for pretesting. Pretesting is obtaining the initial data for the doctor with the technical instruments. And that is the schedule checklist. It's simple to use. It gets great results. Be professional. Be proactive. Use the checklist. This presentation is brought to you by iExperts. We're at www.iexperts.net.